Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Dirk Soenksen. And good morning.
Good morning, Kim.
And so today we're going to talk about the CMS guide model for dementia care. And so you have a very unique company that does some things and in regards to, dementia care. So let's start off with kind of a little background. Tell me a little bit about your company. What does Ceresti do?
Yeah, so thanks for the opportunity, Kim. It's nice to be on your podcast. So at Ceresti, we really started the company with a mission to just improve the experience that families have living with conditions like dementia. Both of my parents had dementia at the end of their lives, so I was their caregiver for a while, and we're going through the same thing with my wife's parents, who also have dementia or some form of cognitive impairment. So it's just really tough. So when we started to think about this business, one of the things we said is we said we don't want this to be direct to consumer. Right? So in other words, we wanted something that was free to the family, but somebody has to pay. So we decided that we were going to go after the payer. So we were going to approach Medicare Advantage health insurance companies and get them to pay for this so that we could offer it to the families of their beneficiaries at no cost to them. So we have a unique business model. And so when you think about an insurance company, they would be financially driven. So we spent a lot of time in our history to do clinical studies to prove that if you actually support a family caregiver of a person living with dementia, you can reduce that person's hospitalizations, you can improve their medication adherence, and you can do things that are financially beneficial to the health plan. So we are like they call it B to B to C. So we sell our services to a business, which is a Medicare Advantage insurance company, but then we go and we enroll people with dementia and their caregivers into our digital health program. The program that we have comprises of sending a tablet to the caregiver, pairing that caregiver with a Ceresti employed social worker coach, and then basically asking that caregiver to report to us what they observe about their loved one so that we can work with them to say, well, should you alert a physician or not if there's, let's say, a change in that person's condition. So we've been doing this for about 7 years. The average person engages for more than 40 minutes a week in the education that's on the tablet, in the conversations with coaches and the assessments. And we've seen really tremendous impact, not only in terms of keeping the person with dementia out of the hospital, but also in the mental and physical health of the caregiver. We've reduced their loneliness, right? We make them feel more supported. So we kind of think it's a pretty awesome program. We have incredibly high satisfaction. The testimonials we get are, just amazing. Some of them will make you cry because they're so heartfelt. But we feel we're doing really good work and we're changing people's lives.
So if I understood you correctly, traditional Medicare doesn't pay for this?
So Medicare, it's complicated, but Medicare, you have fee for service. So if you go to the doctor will use what's a billing code, a CPT code, and that's how they get paid for their services. We don't have a CPT code for our services because we decided we didn't want to go through the FDA and then get a reimbursement code. That's a long path. So what we do is we're in what's called value-based care. Right? So we are an administrative cost to a health insurance company. And we sort of say, if you spend $1 with Ceresti, as an example, right, you'll save $3 and reduce hospitalization costs. And we've proven that that's true. So from their perspective, it's rational. They say, I'll do that. Of course, they also care about their beneficiary, but they are a business and they have to think about the financials as well. But we provide a financial benefit. We guarantee a return on investment when we work with our clients in the types of contracts that we make.
Perfect. And so one of the things you said when you were telling me about, about the company was the benefits to the caregiver, because I'm a huge fan of taking care of caregivers. And so, because you got to keep them well and happy in order for them to take care of their loved ones. And so that's good. So let's dig a little deeper now and tell us more about the particular guide program.
So I'll tell you something. For the last 7 or 8 years, when we have approached health insurance companies, many times we talk to the chief medical officer, who's a physician, who's got an important role in the insurance company. Unless that physician is a geriatrician, many of them have this false belief there's nothing you can do for people with dementia. So when we approach them, first of all, they don't know how many people they have. They have no idea what their costs are. And we say, hey, here's how you find them in your claims data. This is their expenses. And when we do, it just jumps off the page in terms of, how big of a problem that is. And, we're a small company. And so we've been sort of beating this drum for the last 7 or 8 years, saying you should care about people with dementia. What happened recently is that CMS, the Center for Medicare and Medicaid Services, which is the big regulator in Washington, D.C., that pays for all of Medicare and all of Medicaid, so it's probably the biggest insurer in the world, they rolled out a program called GUIDE, which is really guiding an improved experience for dementia. So it's a dementia care program, and they're paying a special fee, a monthly fee, to providers who are willing to participate in this program. So we now have in Washington, D.C., CMS saying dementia is a national priority. I mean, we've all known this. You can't go a week without seeing 4 or 5 articles that talk about how this is impacting the whole world. But healthcare is about the money. And so now CMS has said, look, we are willing to pay doctors or groups of doctors to provide more comprehensive dementia care services. So there's a fee schedule that says if you develop these services, you get paid a certain amount of money per month, right? It's more money if the person, it's actually indexed by the severity of dementia and the burden on the caregiver. So if the caregiver, like a Zared burden, a typical, caregiver questionnaire, if their burden is really high, then the compensation is higher, right? So what makes the GUIDE program exciting is, first of all, you have CMS saying dementia matters. Everybody pays attention to CMS. I can tell you that when we talk to health plans, they now know what dementia is, and they're like, wow, okay, yeah, we're interested. So that's one of the key things. And the second thing is they're willing to pay for this program, which is incredibly exciting. So in our little world, it's like everything is different now, because people are aware of it. And you go on LinkedIn, and at least the people I'm connected with, everybody's got a webinar, everybody's got an opinion, there's questions being asked. So it's very, very exciting.
Well, you do sound very excited about the GUIDE program. So so I guess I should ask you, what's the biggest thing you're excited about?
So think about healthcare in the U.S. So healthcare in the U.S., I'm going to broad brush it, but it's very patient-centric. So the healthcare system is designed to help patients, right? So there's an assumption that a patient can raise their hand if they don't feel well and say, I can go to the doctor. And then the healthcare system, sort of a particular managed care, says, well, look, if you can't get to the doctor, I'll provide transportation to you, right? So many health insurance companies will provide transportation to a patient. They'll also provide food in case it's needed, if there's like a hospital to home transition. There's all these benefits that are really directed at patients who can largely say, I don't feel well, or I want to engage with a healthcare system. People with dementia fall outside of that system. So CMS recognized that people with dementia are not getting consistently good care. They have these super high rates of hospitalization. that are harmful. We know when somebody with dementia goes to the hospital, they come out worse and the caregiver burden goes up. We know this. And so what's the most exciting piece is that at the center of the guide model is the family caregiver. So for the first time, you have the federal government saying, we reimburse for dementia care, and the center of this program is including the family caregiver. That's kind of our model of care in our business, so that we empower and support and increase the knowledge, skills, and confidence of caregivers. And we're just delighted that CMS recognizes this. Now, to be fair, CMS took 10 years to get here. So about 10 years ago, they gave grants to universities, UCSF, University of California, San Francisco. I think UCLA got one. There was about 4 or 5 groups that got grants, maybe 10 million each, to sort of start to develop evidence around like what works best in dementia care. So then the folks at CMS said, well, we've studied this, like our program was presented at one of their webinars by one of our customers, right? So they were aware of us, and there's probably, 10 or 20 organizations that have been working here. And I think CMS said collectively, what should be the elements of an evidence-based dementia care program? And I won't go into all of them, but the caregiver is huge. So we think that is, just as you said, Kim, the caregiver, when it comes to dementia, is arguably the biggest determinant of the health of the person with dementia, right? If the caregiver goes down, right, the patient really has no way to access the healthcare system independently.
It makes it very, very difficult.
Yeah.
And then families are looking to not be able to keep their loved ones at home, but they're moving them to something more expensive.
Yeah.
So the financial aspect of it for families is really difficult as well when they start doing that. So,
Yeah.
So how would the guide program help our listeners?
Well, so this is something that I proposed this question. So the answer is you can't go to the phone book and say who provides the guide model. So this is set up as a pilot study, right? You have to apply if you're a provider group, and we hope to partner with some. But when this program gets going, and it won't get going until the middle of next year, there will be providers out there who will support guide. So anybody who sort of becomes by the way, this is like an amazing program. I mean, this program, it even pays for respite.
Nice.
So think about it. It doesn't pay a ton, but under this program, the federal government will pay $2,500 for respite care. Right? That'll be provided to the family. Now, you might say that's not enough, but it's better than zero.
It is. Anything better than zero.
So there's like amazing elements, right? There's medication reconciliation. There's got to be a home visit if there's a certain advancement of dementia, and so forth. So I think as people become aware of this, and certainly more and more will be published, there's some of the medical journals are now having editorials about the guide program early on. So anybody reading these journals will become aware of it. So I think sometime when this program starts to launch with people who've applied, if you look around in your neighborhood and you say, who supports the guide program, you can go to that doctor. Even if you have a different doctor, even if you like your doctor, but you want to be part of the guide program with a group that offers it, you can join that group. And CMS they'll make available to providers, people in a certain zip code that would be eligible for the program, right? So there may be outreach to those people to say, look, this program is available in your neighborhood, you should come. So it's a pilot, so it's not going to go nationwide immediately. But I think if you are, if you look for a guide provider in your neighborhood, I think you'll find one. And I think this program is just amazing, right? All the things that we think you need to do to improve outcomes are kind of baked into this program. And it's an 8-year pilot, right? So they're going to study it and then they'll improve it. And, at some point it may be more broadly offered and paid for, by CMS.
So what is your company, Ceresti, doing to support the guide program? How are you all involved?
Yeah. So if you think about it, we've been doing this, by the way, so the program is not available to Medicare Advantage. which is kind of interesting. So, the federal government gives a lot of money to Medicare Advantage plans to support beneficiaries with various conditions. And there's ample incentives for these Medicare Advantage plans to support dementia patients. They just haven't had the nudge to sort of do it. So now that CMS says, I care about this, the health plans obviously are going to say, look, if CMS cares about it, I need to care about it. So it's changing their calculus. But ask me the question again. I just want to make sure I'm answering it.
I just want to know what Ceresti's doing to support
So we largely have an intervention, which is the guide program. So we are teaming with providers because providers have to apply to sort of round out the offering. Like as a provider group, you have to have caregiver education and support. You have to have caregiver, you have to have a helpline. You have to assess caregivers. Doctors don't do that today. So no provider group can do this independently. So we're teaming up with provider groups, and then we're going to jointly apply for this program. So for us, it's kind of taking stuff that we have developed over time, and we're approaching a provider saying, look, most of the lift for this program has to be done by a company like Ceresti. So we're kind of a turnkey solution for this program. And there's lots of other companies, competitively are going to say, look, I can do the same thing. And, that's the nice thing about a free market. So there'll be partnerships. CMS is looking for diversity. So you're going to see a lot of academic medical centers and academic institutions doing this. They're going to apply for this program. It'll pay for some of the services they're already doing now, but they'll get reimbursed for them. There'll be probably virtual provider groups who will stand up and says, look, I can do this all, online with technology. There'll be people like us who can say, look, we can provide the non-medical piece. We partner with medical folks. If you're home care, home health, you can be it's kind of a subcontractor to a provider group that applies. So I think there's going to be really interesting partnerships formed that will be then studied by CMS to sort of say what works best in terms of outcomes. And a big element here is health equity. So as you may know, the big issue or the big emphasis on CMS for the last years has been health equity or health inequity. And we know that people who are Black and Hispanic have higher rates of dementia. We know that they have a harder time getting access to a physician. We know that their diagnosis of dementia lags years behind those of people who have more financial means and better access. So across the system, if you think about populations that are really, really, really underserved, dementia is certainly one of them. And so, it's kind of funny, when we think about the government, they tax us and they have bureaucracies. And sometimes it's hard to get excited about what the government does. But I mean, this is really an amazing program. And most people who have been in this space and who look at what's in this, they say this is just really, really spectacular. So kudos to this. What did you say?
I said, that's good to hear.
I know. I mean, I'm kind of a cynic too.
Yeah, something that really benefits our listeners, and it's like, and you said it without sarcasm and everything. So it was just the irony of it is there, and I'm super glad that that you're doing what you're doing. But can families access the Ceresti program directly, or do they have to find that doctor that's working the program?
So, this is a specific question around Ceresti. So we started the company, as I mentioned, really going direct to the payer and proving that we can create a return for the payer. So we don't have like a simple way for people to access our program today. We've done it on the side for kind of friends and family. This could change over time. So I think, over time, we might say, okay, if you want the program, you can just contract with us directly. We really would prefer a partner, right? So if we had like a partner that had access to consumers, that would be the best of all worlds. So so today, it's kind of hard, right? So I'd say the best way to get it would be to find, again, we're small, right? So it's not like you can go, look in your local directory and find us. We're not that big yet. So at the moment, this is difficult. We're not really a direct-to-consumer offering yet. I think that could change over time.
Perfect. And so, so if anybody wants to get any more information about the Ceresti program, how do they find you?
Yeah, so I think you're flashing my email and phone number up there. So, and we have a website. We'd welcome anybody who wants to learn more, who has suggestions about how we could potentially partner or help. That would be fantastic. And yeah, as I said, if as we start to develop a relationship with providers who offer this program, we'll put them on our website. And if you have access to those providers, then you can get access to our program via guide.
For those of our listeners that just listen and not watch, so the website is ceresti.com. Is that correct?
Yes.
And then the telephone number?
So 760-492-8957.
And if they want to email you directly, be sure to spell your name.
Oh yeah, so this is unfortunately a little tricky. It's my first name, Dirk, and then my last name is Soenksen. So it's S as in Sam, O-E-N like Nancy, then K-S-E-N, pronounced Soenksen. So it's Dirk.Soenksen at Ceresti, and that's CERESTI.com.
Perfect. Well, this has been a huge education for me. So I really have enjoyed you being on the program today. And I look forward to your success because I know how much caregivers, I mean, I see them all the time in my office. So I know how important it is to take care of caregivers. And so I appreciate your work immensely. And we look forward to having you on the show again soon.
Thank you so much, Kim, and have a great rest of your day.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.